specialized for eating disorders. So, okay, to start, I think it's important to say that diagnostic interviewing is crucial to both clinical work and research with patients with eating disorders. Of course, this process is essential for the treatment planning. It provides information about the outcome and could provide also the foundation for the therapeutical relationship. This process, of course, could be difficult for a number of reasons. For instance, patients often report difficulties remembering their symptoms in an accurate way. They can try to minimize them in order to avoid the treatment, or they may lack of awareness to be able to answer. When we ask, for example, about the influence of the shape or the weight on the self-evaluation, this could be a complicated concept that requires patients to have both the self-awareness and the abstract reasoning ability to identify how to determine their self-evaluation. Eating disorder patients often feel isolated, as a colleague before already told, ashamed, confused about the disease. So empathetic questions that reveals a deep understanding about thoughts, feelings, and behaviors can facilitate an alliance between patients and the clinicians. So going to the diagnosis process, let's see in details the procedure we use to follow. Prior to the assessment, all patients should fill in questionnaires like the eating disorders examination, the EDQ, and the clinical impairment assessment questionnaire. So we can determine the severity of the eating disorder in order to have a starting point. Then we go to the real psychological assessment. Going to the, I'm following also a psychoanalytical approach because, so going to the roots of the disease, its characteristics and the related difficulties. First, we explore the reason why they are asking for help in that moment. So, and then we explore the beginning of the disease, the current problem as it's perceived by the client and also by the others. Then we do an accurate anamnesis, possibly also with the mother separately, in order to investigate also the feeding and the weaning period. For instance, I took part of, but today we don't have time to talk about it, but I took part to a scientific research with the University of Milan, and we saw and we explored how the feeding time and the weaning time is correlating to the start of the eating disorder during the puberty and adolescence. Then an exploration of the eating habits. We used to do an exploration of the eating habits of the client and also of the family. Very important is also to explore the atmosphere during the meals, for example. Then we can use other questionnaires, for example, the SCID-1 or personality tests like the Rorschach personality test or the Blakey pictures, in which we explore we investigate, the origins, the personality. And we can use also an intelligence test in order to explore the cognitive resources. And at the end of this process, we build the treatment plan, and so we can start the